Welcome back to the Island Docs. You're watching our episode on heart attack. We're continuing our discussion with Dr. Mohamed. All right, Dr. Mohamed. We had our guest, Mike, who had triple bypass surgery.
Yes.
For someone like him, what do you have to say to him after the fact, after he's had his procedure?
Okay, so with triple bypass surgery, it's essentially they've bypassed all these occluded or highly occluded blood vessels. They've taken blood vessels from other parts of your legs or your chest and bypassed that, allowed the area to be circulate, to get blood supply from that part of the heart. So with these patients, it's going to be lifelong chronic management of their underlying issues. If they have high blood pressure, the blood pressure needs to be better controlled. If they have diabetes, the diabetes needs to be better controlled. High cholesterol, any reason why it led to this issue of having the triple bypass in the first place. A couple of the things for him to expect is he'll be on medications that he'll have to take almost every single day. And these medications he has to be very compliant with. If he doesn't take these medications or does not adhere to what his doctors are saying, especially his cardiology doctor, he'll be more prone to developing another episode of a heart attack. In fact, the blood vessels that are done with the bypass can be prone to developing the exact same thing that happened to his initial blood vessels.
Wow.
So if his cholesterol again is not under control, if his high blood pressure is not under control, if his diabetes is not under control, those same blood vessels that were bypassed now might actually develop the exact same thing. And in those cases, if it does happen again, they have other options of doing another stent inside the bypass vessels themselves. But eventually, if they have to bypass everything, if they're not able to stent anything else, he may need complete heart transplant, and you don't want to get to that point because the mortality for complete heart transplant nowadays, even though the medicine has gotten better, is still very high. So he has to adhere and treat his underlying issues and take his medications every day.
Okay, so now my question concerning heart attack is for those guys out there, those older men or maybe young men who likes to abuse the drug Viagra because they want to get that sexual prowess, and that can have a deleterious effect on your heart.
Yes.
So please expand on those guys who are out there. This is for you, the Viagra poppers.
So with Viagra, it's a medication that what it does is cause vasodilatation or dilates blood vessels.
Yes.
So what happens is that it's great to achieve an erection with because it's able to dilate blood vessels and have blood rush in and you get an erection. But at the same time, it has a bad effect on your heart. With vasodilators, they dilate the blood vessel throughout the whole part of the body and cause what is hypotension. Hypotension, which means low in blood pressure, is a bad effect just as it is with not getting enough blood supply to your heart. It's essentially almost the same thing. When you have occlusion of the blood vessels, there's no blood supply to the heart. When you have decrease in blood pressure, there's no blood supply to the heart. When you have that decrease in blood pressure, that part of the heart becomes ischemic because it's not getting enough of blood supply. And again, another episode of a heart attack. So with those patients who take blood vessels, who take medications like Viagra, who dilate their blood vessels, I would be very careful and talk with your cardiologist, talk with your primary care doctor, see if you're able to take those medications safely and effectively without, can't just be popping any medications out there.
That's interesting, So that's especially out there for you guys with the Viagra. So we're running out of time, so I just want to give a special thank you to Mike, who came on and gave us his enlightening story.
Yes.
I'd like to thank Dr. Mo again for coming on and sharing his information about heart attack. And don't forget to like us on Facebook. And if you have any questions or concerns, feel free to message us at theislanddocs@gmail.com. Our apple for today is, if you're experiencing any type of chest pain or you're concerned about having a heart attack, then do not hesitate. Get to your healthcare provider as soon as possible. Until next time, see you later.